Indiana's emergency medical services are in a state of crisis. That's according to state surveys showing cities and counties unable to staff ambulances with a full crew. Ethan Sandwise takes a local look at the problem and investigates what counties do when EMS services collapse.
Imagine this intersection at night. It's November and IU students are celebrating their team's victory over University of Michigan. A car going 40 miles per hour strikes 4 women, all of them students, as they're crossing 17th Street. At least 2 of them go airborne.
We have one with heavy head trauma, one possibly borderline unconscious, and one critical.
Monroe County's main ambulance service provider, IU Health Lifeline, had 4 active trucks, but all of them were busy. Monroe Fire Protection District sent 1 for backup, but there were still 2 girls who needed help. Dispatch called the neighboring counties, but the only one with a free ambulance was Brown County. Before the Brown County ambulance arrived, 2 IU Lifeline ambulances finished their runs and were able to come to the scene. The system held, but it was a close call.
We frankly have seen a couple of counties in Indiana where the local system failed, and with just like a few days' notice.
Once an EMT, Kinney tracks Indiana's emergency medical services. He says a crisis has been brewing for years.
We are at a point where we either need to fix EMS or we do risk the system collapsing.
Many EMTs and paramedics are leaving for higher paying departments or getting out of the field entirely. A state survey shows that low pay is their top concern. Monroe County used to give Bloomington Hospital ambulance service $100,000 per year, a small fraction of its overall budget. The county eliminated that subsidy in 2010. EMS can overwhelm private services like Lifeline because it's nearly always unprofitable. Many emergency patients are uninsured or unable to cover an ambulance bill. That leads to cost-cutting measures such as lower salaries and fewer trucks.
I left IU Health because I both got sick and I got burnout. I mean, the average EMS career is what, 2.5 years? I certainly understand why somewhere like that, people burn out quickly.
About the only way for ambulance services to make money is transfers, shuffling patients between hospitals and nursing homes. That's important, but it diverts resources from emergency response.
So if someone needs to go from IU Health Bloomington to Methodist for treatment, the same ambulances that do 911 will be doing the transfers.
IU Health did not respond to a request for comment. But when one Indiana county's EMS system collapsed, locals saw an opportunity to rebuild. Today, it's one of the strongest providers in the state. Private service Care Ambulance pulled out of Martinsville in 2017, and Morgan County lost its main EMS provider. Local government and Lifeline stepped in with ambulances offering basic life support instead of advanced life support.
That was very scary because it was just kind of thrown together as a Band-Aid while all of this was going on. So I think it opened everyone's eyes up and they're like, we need to do something.
Morgan County's government approved a small property tax increase to fund a public EMS service. Although Morgan County has half the population of Monroe County, it now has more full-time ambulances devoted to emergency response. It doesn't do transfers.
I feel very confident in the service that the community is getting now that we have 6 ambulances to cover what we used to not even know if we had an ambulance to cover.
Smith still lives in Monroe County and commutes for the job.
It's a lot better working for a county because I'm an actual government employee. I have better pay, I have better benefits. We tend to buy the best stuff.
When all the trucks are busy, the township fire departments can step in, but Morgan County doesn't seek help from neighboring counties.
Since I've been here, we've never called in another service to assist.
Despite its success, municipal EMS organizations like Morgan County's represent just 11% of providers statewide. They're outnumbered by volunteer fire departments and private EMS.
I would love to see a third service in Monroe County that would require investment, that would require tax funders basically to pay for it, like we've done here.
For Indiana News Desk, I'm Ethan Sandweiss.